Another disease that we're investigating in collaboration with Reponix Pharmaceuticals is inflammatory bowel disease. Inflammatory bowel disease is a disease that is affecting thousands and thousands of patients in Denmark and globally. So in Denmark, more than 50,000 patients has inflammatory bowel disease. So globally, preferably or particularly in the Western world, it's a huge challenge. At the same time, it is a disease that we have not yet found an effective therapy for, and especially for those patients that has pouches after surgery for inflammatory bowel disease. We don't have any effective treatment for these patients that are typically young and has a tremendous impact on their quality of life. The collaboration with Reponix Pharmaceuticals is based on trying to make disease modification in those patients that has a pouch. A pouch is a reservoir of small intestine that has surgically been put where the rectum was before. So the patient has its stool, his or her stool, concentrated in a pouch and then can defecate the normal way, so to speak, without a stoma. So these patients does not have a large bowel because it has been resected. The colon has been resected. A great problem for these patients is that they are having frequent stool passages. They have pain, bloody, slimy, sometimes up to 20-25 times they need to go to the toilet. And this is something that is severely affecting the quality of life. So if you look into patients with pouch disease, it's almost 50%. In some papers, it's even more than 50% of the patients that has some kind of a pouch-related symptom that affects their quality of life. So this is where we are testing a novel approach for treating this condition in these patients with a pouch, where we give an immune stimulator, at the same time a combination antibiotic locally into the bowel lumen. So what we are doing in this collaboration is actually to understand how this cytokine, this immune modulator, in a disease where it's primarily the autoimmune system that is acting towards your own tissue, where the cytokine GM-CSF, based on our initial data, actually shows that it can go in and block some of this activation of the immune system, which is poor for the patient. And while at the same time giving metronidazole and fosfomycin that can adjust or change the microbial contexture of the inside of the bowel. So the net effect will be that we see that our patients are actually feeling that even after one single treatment, that they do better after 1 week of evaluation. So what we see is a need for a different type of treatment, where we again can give a very potent immune modulator at a high concentration at the tissue that is affected. So this is why the principle of this drug treatment is to inject the drug inside the pouch and make sure that this common gel and the fosfomycin and the metronidazole is dispersed around the mucosa, so the inner lining of the bowel. And that's where it can work. And this is where we have seen these surprising results, even after just one treatment, that the patients are actually both having less symptoms and also has an effect on the immune activation and also the microbial constitution. And at the same time, we can also show that when we are looking into tissue samples and we're looking into microbial samples, that we actually can see that by just giving one-time treatment, again with this novel approach of giving local therapy into the pouch, we can see some significant changes in the disease mechanisms running the symptoms of the patient. So we are very optimistic with respect of what the perspectives of this drug is going to be. The next phase of the trial that we are running now is a daily doses for 7 consecutive days and then measuring the impact after 1 week of waiting and looking in again what's the effect on the patient's symptoms and what's the effect giving this higher or the frequent dosing for 7 days.